You're watching CTOM TV. Knowledge is power.
And so liquid biopsies, this is a new technology, and we've been using it for quite a few years. We have developed our own, what we call an exosome-based liquid biopsy, where we isolate DNA, fragmented tumor DNA from the exosomes. And so exosomes are basically little packages that tumor cells and normal cells release into the blood and the lymphatic fluid and the surrounding tissue. And they're basically a way of sharing information, sharing RNA and protein and DNA with other cells, and they're a form of communication. Unfortunately, cancer cells use these to grow and metastasize. So when a cancer cell is about to metastasize, it will release a lot of these exosomes with mutated DNA in it. And this will go through the blood and different tissues, and they can be used to prime an area for metastasis. And actually recently, it's been found that certain cells can take up these exosomes or the products of these exosomes, the cargo of these exosomes, and it can actually convert normal cells into cancerous cells by taking up these altered RNA and proteins and genes. So what we do is we use this as a surrogate to determine responses to a particular drug, because that's pretty important. So if your tumor has, let's say, a KRAS G12D mutation, we know that mutation is an early event. In other words, it's one of the first mutations that happens when your normal cells get converted into tumor cells. And so we know that that mutation is going to be in the vast majority of your tumor cells in your body. Maybe not all of them, but the vast majority of them. We also know that when your tumors are going to be metastasizing, they're going to be releasing exosomes that contain that particular mutation. So what we'll do is we'll create a probe for that mutation, or we'll use a ready-made probe for that turns a certain color when that mutation is present. And we'll look at the relative amount of that mutation in your blood to determine whether your cancers are actually responding to treatment or not, or whether you're in remission. And we've found that this test can actually detect tumors at a very, very small stage before they even actually form a solid tumor, or solid tumor that's detectable. So most imaging can only detect a tumor that's about half a centimeter, a few millimeters. With liquid biopsies, we can detect this tumorigenic activity going on months before even a tumor that size is able to grow. So what will happen is, let's say we want to use it to monitor whether a drug is working or not. So, we don't want to have to worry about whether the drug is working and have you become a petri dish for 4 months and see, whether the tumors are getting bigger or smaller, because some of these drugs are very expensive. If you're paying for the drug yourself, you want to know if it's working very quickly. So this is a great tool that helps us do that. And so what we'll do is we'll take a sample of the blood, and if your KRAS mutation is, let's say, 8% before treatment, and then 2 weeks later after your treatment, it's down to 2%, then we know that that drug is working. But if your KRAS mutation stays the same at 8% or gets higher, then we know that treatment's not working, and we'll switch up the drug right then and there. So we don't have to spend months and months and months on a drug to see if it's working. We can find out very quickly whether a targeted therapy is working or not. And this is also a benefit in immune therapy, because immune therapy, you can have what's called pseudoprogression, where the immune system enters the tumors and makes the tumors actually look bigger when you get a scan. And so normally you'd use a PET CT to see if your tumors had biological activity. But in pseudoprogression, because the immune cells are metabolically active, they also drink up a lot of sugar, and that gives you a false positive result on a PET scan. So many patients have taken immune therapy, they've had pseudoprogression, happens in about 20 to 30% of patients. And then the doctors say, oh, your tumors are getting bigger and there's new tumors, and they take them off the treatment prematurely, when what's actually happening is the immune system is making those tumors look bigger, and the treatment is actually working. So this ctDNA liquid-based biopsy is able to tell that. So if you have pseudoprogression, you're going to have a low amount of your tumor-specific mutations, regardless if your tumors are getting bigger or not. And so we've had many cases where we've been able to keep patients on effective treatments that their doctors were about to take them off, because we're able to show that the treatment is working through a liquid biopsy.
Thank you for watching CTOM TV. Subscribe below and stay informed.